Hi, this is Ciara Wright, and this is just more like a short blog as such about some other things to consider when you're thinking about egg quality. So, egg quality is often a concern for patients. It's clearly a significant factor as we age, and of course, the average age of conception is increasing. So, this is a common issue we see in clinic. Maybe you're just aware that you're over 35 or 40 and you should be taking steps to mitigate this. Or perhaps you've had many months or years of trying with no success. Or perhaps you've had some IVF cycles where a low number of eggs developed, or perhaps there was poor development of embryos. If you were told that egg quality is an issue, well, maybe just to begin with, I might direct you to some of the other resources here. So firstly, the article on the same page about supplements might be useful. And then at the end of this page, there's also a link to our general information pages. And there's information there about how to support egg quality also. But for now, I just wanted to consider some other reasons, perhaps besides age, that might impact egg quality. And age, we cannot change, of course. So if we just cover off basic diet, our fertility-friendly diet is high in antioxidants, which may help protect eggs as they mature in follicular fluid over a 3-month period. We can't change the number of eggs remaining, but perhaps just to give those that are the best chance, we should focus on a diet rich in fruits and vegetables, nuts and seeds. Moving on from this though, I want to talk about the environment in which these eggs are maturing. So yes, we need antioxidants to protect the eggs, but what if the environment where they are is a pro-inflammatory environment? You might just be using up your precious antioxidants and reducing the protective capacity for the eggs. So one reason you might have an inflammatory environment is endometriosis. It's an extremely common condition and in some cases quite debilitating. So this is when uterine tissue is deposited outside the uterus, usually from what's called retrograde bleeding. That is when menstrual blood is going out from the ovaries and into our abdominal cavity. It can cause all sorts of issues, often resulting in an inflammatory reaction. So if you have endometriosis, you may suffer from severe pain and other problems, but also just bear in mind that your egg quality might be indirectly affected from an increased demand for antioxidants. So again, a good diet for endometriosis concentrates on replacing these antioxidants whilst focusing on anti-inflammatory foods. Other immune imbalances have an impact in the uterine environment. Now, don't pay too much attention to this slide, just listen to me. An implanting embryo is not fully recognized as self because it's made up of both male and female genetic material. So therefore, your immune system needs to be quite well managed in this environment to avoid, and I hate this term, but it's immunological rejection. And I mean that in a purely scientific way. I really don't like using that word. But it's actually really astounding the number of factors and cells that are at play here that allow a non-self embryo to implant and flourish in a healthy pregnancy. But the immune system is like an orchestra with all these different parts. And if one part is out, then the whole balance can tip. We need a relative amount of calm here. And if there's inflammation or an overactivity of the immune system, then this can result in poor implantation, reduced fertility and pregnancy rates, and or recurrent miscarriage. Now, there are a couple of specific cell populations and inflammatory signals that we're looking at. So one are your NK cells, which can be highly active against foreign cells. Another one is the cytokine balance between your Th2 side. These are usually fighting off infections, and your Th2 side, which is usually more associated with allergy. Now that's kind of simplified, of course. But in a healthy pregnancy, there should be low levels of these active uterine NK cells and a balance in the direction of the Th2 side and a reduced Th1 response. If this is tipped in the opposite direction, this can cause some problems in the uterine environment. Now, we support lots of our patients with immune imbalance, and in many cases, a protocol does need to be personally tailored. But that said, starting with an anti-inflammatory diet is an excellent first step. Now, your anti-inflammatory diet, not unlike your general fertility-friendly diet, high in omega-3 rich oily fish, omega-3 being one of the best anti-inflammatory foods that we have, and low in pro-inflammatory omega-6 from your red meat and dairy. You don't have to exclude these altogether, but the balance is definitely important. It's also worth mentioning that reducing body fat can result in a calmer immune system. So being obese or overweight is a pro-inflammatory condition, particularly when there's a lot of fat accumulated around the middle. This isn't like regular fat, it's very metabolically active, and the cells here actually produce quite a significant amount of pro-inflammatory cytokines. And then the last consideration I want to mention is about our digestion. And some of us have never considered how this might impact our fertility, but actually it does in a couple of different ways. I have discussed in the fertility friendly diet webinar how we are not necessarily what we eat, but what we absorb. So we need to consider our digestion in terms of how much goodness and nutrients we're actually getting from our food, no matter how good our diet. But when we think about the immune system, up to 80% of our immune cells and tissues surround the gut. And this is because it's a major interface with the outside. I mean, we're putting foreign bodies into our gut all day long, and there has to be a high level of vigilance. So it stands to reason then that a lot of immune activation occurs at this gut interface. So if you have digestive issues, it could be that your immune imbalance is stemming from this. It's also really important to think about your good bacteria, your beneficial bacteria. Are you feeding these with enough fiber? Again, coming back to the diet, plenty of fruits and vegetables, the pulses, really high in fiber, nuts and seeds, because your good bacteria play a really important role in teaching your immune system what to overreact to and when to stand down. So we've actually seen on testing people with fertility-related immune issues who they have really low levels of beneficial bacteria, and sometimes even when they don't have major digestive symptoms. So just to recap, look into an anti-inflammatory diet and consider calming the system. Consider weight management if that's an issue for you, and don't forget about your digestive system and your really helpful beneficial bacteria, because they really do so much for us. Thanks.